Hello everyone, today's video is about SIBO and LIBO and prokinetics and prebiotics and just a whole bunch of different stuff related to those topics. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the question today, it's kind of a multi-part one. So it says, I'm wondering if you could share a video on the topic of probiotics, prebiotics, and prokinetics with regards to SIBO/LIBO. There's a lot of information out there, and I really want to have an idea of how they may help and which would be more useful. Is there a way to know based on symptoms if one has overgrowth or undergrowth of intestinal bacteria, etc.? So thank you for the questions, and good topic, and just perfect topic for a video today. So where to begin? When it comes to SIBO and LIBO, maybe just okay, so question is about probiotics and SIBO and LIBO. So generally speaking, in my experience, probiotics tend to be fairly neutral in the when there's the playing field of SIBO and or LIBO. When you look at the research literature, the majority of the research literature, like the vast majority, shows that probiotics can actually be a bit helpful for SIBO. That's in contrast to what you'll hear a lot of folks out there talking about or posting about, saying like, probiotics and SIBO are just, no. They're like, oil and water, like you just do not want to mix them. And the concern there is largely because, sometimes there's concerns about like histamine producing probiotics and things like that in the realm of SIBO and LIBO, but normally the concern is that we don't want to give any prebiotics along with when there's SIBO or LIBO, because there's the concern that the bacteria that are overgrowing are going to feed on those prebiotics and make things worse. In clinical practice, I find that probiotics are usually just a net neutral. They don't really move the needle one way or the other. I've certainly had patients with SIBO who flare from probiotics, but I find it's relatively rare, much less than you might expect, hearing some of the things online that they talk about. But in the research literature, most of the studies show that probiotics rather are actually helpful in a SIBO backdrop. With LIBO, we really don't have the tangible research literature telling us these same things about LIBO, but I would say clinically I feel like the same is true. So it doesn't really move the needle that often one way or the other. As far as prebiotics go, now that's a different kettle of fish, because when it comes to the amount of prebiotic that's in most probiotics, it's usually a pretty small amount, unless you have some combination formula that's marketed as prebiotic and probiotic, and they're giving you like tons of inulin or FOS or different things like that. What I do find is that prebiotics are a common aggravant when folks are dealing with SIBO or LIBO. So I find oftentimes in my patients, we'll see an increase in gas and bloating and abdominal discomfort and different things like that. So I unfortunately find that prebiotics are usually not that helpful, which is a bit unfortunate because we know that prebiotics, as a rule, seem to help improve gut microbial biodiversity in a good way and whatnot, but just they do seem to aggravate things. Now, something I've been working with, I actually learned about this from Dr. Kathleen Janelle. We had, in my opinion, a great interview all about high-dose sulfur therapy using high-dose sulfur therapy using MSM. Please check that out if you're interested, because for many things gut-related, it can be just it's like one of my top 5 therapies now for chronic digestive issues. So I love high-dose MSM for many of my patients. But one of the things that she relayed to me, not during that interview, but in a separate correspondence, is that using acacia fiber, also known as gum arabic, that is a form of fiber that is in a prebiotic, for that matter, that does not seem to ferment in the small intestine. So it actually seems to be very well tolerated. And I've been seeing that in my patients, that it does not seem to aggravate in the same way that other fiber supplements like psyllium and oat bran and different things like that might. So that might be a bit of an exception. That being said, I don't oftentimes have cause to use prebiotics when I'm treating patients for SIBO and LIBO, because oftentimes we get pretty efficient results. Now, efficient is a relative term. I would say on average, between like 2 to 6 months after diagnosis, patients are good to go. That's true of about 80% of cases. There are 20% where it's a longer road if there are biofilms and other concomitant pathologies, and if the patient's really sensitive and it takes forever to build up on the therapeutic dose of antimicrobials, et cetera, then that can certainly throw a monkey wrench in those numbers. But I don't really find I need to use prebiotics when patients are dealing with SIBO and LIBO for the vast majority of cases. As far as prokinetics go, With respect to non-pharmaceutical prokinetics, I've been pretty underwhelmed with their efficacy for the most part, and that is a sentiment that I've heard echoed by other colleagues as well. Sometimes ginger is helpful, sometimes digestive bitters are helpful in that regard. They can be helpful for other reasons over and above a prokinetic effect, but seems to be a bit hit or miss. Using peppermint essential oil, sometimes seems to help, sometimes it doesn't. Now, when you start getting a little more like still pharmaceutical, but a little more non-standard prokinetic, things like LDN, like low-dose naltrexone, again, I find it's a bit hit or miss in the SIBO community, but that seems to pack more of a punch on average than a lot of the non-pharmaceutical prokinetics. And then there's good old, oh my gosh, what is the word? Resitran is the one name for it. Precalipride, that's the one. It just rolls off the tongue when you remember what it is. Precalipride, also known as Resitran, is a prokinetic pharmaceutical, and that's like really, really good, really effective, I should say, in a lot of cases. Now, I have had patients who have been on precalipride, and it has not made a significant difference, unfortunately. But yeah, prokinetics, it's yeah, we don't really have the best track record in the non-pharmaceutical community in my experience up to this point. Now, if folks listening or any colleagues listening are like, hey, I've seen really great results with X, Y, or Z, please let me know. I love collecting, tabulating that information, and maybe there's natural prokinetics I haven't heard of that are out there. I've had quite a few patients who have tried quite a lot of them. I mean, I inherit a lot of chronic SIBO patients. Folks consult with me from all over the place, and they're like, yeah, I've done everything under the sun. I'm like, wow, you've been a very, very diligent patient. You've tried all these different things. And I asked them, like, what worked, what didn't? And oftentimes a lot of the natural prokinetics just don't really seem to move the needle a whole heck of a lot, unfortunately. So let's see here. Hopefully I covered a lot of that. And then there's the one last question here was, is there a way to know based on symptoms if one has overgrowth or undergrowth of intestinal bacteria? So, I mean, inconveniently, the answer is not really. I mean, we can tell if there's an overgrowth in most cases based on whether there's gas and bloating, because the intestinal gases that we experience as part of that gas and bloating experience, those are made by microbes in our intestines. Our intestinal cells make gas. It's called carbon dioxide, and we breathe that out. It goes into our bloodstream, and we breathe it out. We don't, burp up or pass bowel gas in the form of carbon dioxide. So all of the intestinal gas that we produce and excrete is all from bacteria or yeast in the intestinal tract, to my understanding. So if there's bloating, we can assume that there's probably some type of microbial overgrowth. Just we can't really tell whether it's small intestine or large intestine. Some folks will say, oh, if it's like higher up in the abdomen, it's small intestine, lower down is large intestine. But if you look at a picture of where our small intestines are located, they're really they can potentially cause symptoms anywhere. So you really can't tell for sure based on clinical presentation, to my understanding. And then you add parasites into the mix, and where those parasites could coexist with other types of microbes. Like, you just really don't know based on symptoms. You can get some little clues, like if there's rectal itching, that's maybe more likely to be related to parasites. There's some mixed research out there on whether tooth grinding is associated with parasites. Flare-ups around the full moon are sometimes talked about being associated with parasites, which I think is probably true in some cases, but I don't know about any definitive research literature saying that that's definitely the case. So we sometimes get some clues, and then someone's craving a lot of sugar, or sugar makes them like a lot worse almost right away. Sometimes that can be a clue that there's a yeast overgrowth issue. So we sometimes get some clues that way. But yeah, there's not really any definitive clinical signs or symptoms that tell us, or I should say clinical symptoms that tell us definitively that it's this or that overgrowth or undergrowth. In terms of undergrowth, I mean, typically that's a reference to, like, are we low in probiotics? And being low in probiotics will sometimes present exactly the same as if we have an overgrowth, because that could also lead to some gas and bloating, nausea, abdominal pain, constipation, or diarrhea. So yeah, really clinically, it's hard to tell. Now, based on the patient's history, in terms of like the timeline, I should say, in terms of how when their symptoms started to arise, sometimes that can be a clue. A classic one would be all my digestive symptoms started after I took this fateful course of antibiotics. Well, more likely dealing with a probiotic deficiency. It all started after food poisoning, more likely to be SIBO, but it can really vary a lot. So I hope that this information was useful. Any follow-up questions, feel free to post in the comment section below. And folks, don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. So thanks in advance for taking a second to do that. And any question or comments on any other topic, just post in the comment section below, and I will do my best to answer as soon as